Hi, how have you been? Okay, before we begin, I have to make a quick disclaimer. This content, the information that we're going to get into, is designed to offer general guidance and is not a substitute for professional intervention. So if you are in crisis, if you need immediate help, I'm going to link some resources to you below. Now, that stuff out of the way. Let's get into it, shall we? So many of us face the challenge of managing our mental health. And I know a lot of people, if we really get down to it, don't have access or the time or whatever. There are lots of things that get in the way with seeking traditional therapy. Sometimes it's financial, sometimes logistically it's out of reach. And I want to speak to that because over the years, what we're seeing is limited insurance cover become more of a thing. Even from before, there is persistent stigma associated with this. And if you're like, oh, it's more accepted than it's ever been, I would in some ways agree with you, but in some ways I would disagree because I hear almost more talk of people with mental health issues being stigmatized. And the other thing that I want to mention very briefly is that the rising impact of inflation on personal finances is already acting as a limiting factor. And this has already been difficult for people. So what I wanted to give you all is kind of an overview or a breakdown of what is therapy. Even if you're one of those folks who are just not really open to the idea, like that's okay. So I want to talk to you about what therapy is, broadly speaking. And so even with these rising barriers or with your own personal barriers, you might find yourself benefiting from at least kind of an overview of these concepts. I'm going to draw on Martin Seligman's PERMA model. This model includes 5 actionable steps that break down the overall process of managing one's mental health. Now, therapy has a few key steps that I want to mention. The first is kind of this general assessment stage, right? Where we need to be trying to determine where is our problem, if you will. What is getting in the way of, and let's define what is mental health, either my daily functioning. So that can include, of course, the classic getting out of bed. If I can't get out of bed, that might be a more severe form of it. But for a lot of people, their functioning is typically more impacted by having to do the things still, but it's painful. It requires a lot more energy, a lot more effort. So we would need to assess what's going on. So for instance, if I'm having a hard time walking to my car because I've hurt my knee, that wouldn't necessarily be depression per se, but I could be experiencing some secondary issues with depression if I am typically an active person and now I can't do these things that I used to do. And let's say that I have this concept of myself of being this really active go-getter. And so a big issue that we run into in mental health is this concept of rigidity, where I have one locked in way of thinking and I can't shake from that. I can't be flexible in that way of thinking. So the next step would then be to engage in kind of the treatment, if you will, once we have an assessment of that problem. So the treatment's usually going to involve 2 to 3 sort of main groups of activities. One would be kind of depending on your situation, first processing and validating what it is that you are feeling, what you're thinking, and what you're doing differently as a result of that. And we're going to try to help you as therapists understand the relationship between those 3 things. And very commonly, what will happen is people are trying to problem solve the emotion itself, which may or may not be related to what is actually happening. As we kind of may or may not know, a lot of our thinking is not just influenced by the thing itself that's occurring, but our past experiences and, more importantly, our interpretation of those past experiences. We're going to help you look at what those patterns are, understand them, get your head wrapped around them, develop clear, concise language around them, And then we're going to help you basically determine, is that thinking really helping you out? Is there a better way that we could look at what's happening? Better way that we can understand what we've been through and kind of do some reinterpreting or some sort of reframing, or if not reframing, just determining what we kind of lean into, because emotions give rise to urges, urges give rise to thoughts, and those thoughts give rise to actions. So once we kind of understand that relationship, we can then start to intervene on our own behalves instead of just being kind of under the control of our more habitual minds or subconscious minds. And then the last thing that we're going to do, once we've really got a good grasp on that and we're putting into practice different interpretations of events and actions and what have you, is then we might feel better. But early on, we also try to be very clear that we might not feel better at first. In fact, oftentimes we're going to feel a little worse. So another major component of therapy usually involves helping people learn to tolerate discomfort, pain even, because when we are trying to avoid inevitable pain, that's what leads to suffering.